Welcome, everyone. We're going to give this just 30 seconds for everyone to enter the webinar. Welcome, everyone. Thank you for joining us. My name is Chris Day. I'm Vice Provost, and I'm going to be the moderator for our webinar today. I know folks are continuing to join, but I think we can go ahead and get started. I want to start by saying welcome back to everyone for the 2021-2022 academic year. And I think it's appropriate to begin with a sincere thank you to all of our faculty for all that you've done, all that you're doing, and continue to do on behalf of our students and on behalf of the NYU community. Thank you for your commitment to our teaching and research mission. It's very deeply appreciated by certainly all your schools and by the entire university. I want to start by introducing our panel today. You're going to be hearing from Dr. Carlo Ciatoli, who's our Associate Vice President for Student Health and the Executive Director of the NYU Student Health Center. You'll also hear from Gigi DePico, who's our Vice Provost for Academic Affairs, and from Clay Shirky, who's the Vice Provost for Educational Technologies. Let me give you just a minute about how our format's going to work for this webinar. Carlo, Gigi, and Clay are each going to give remarks, and their remarks are designed to address things that we know are on your mind, and specifically questions that we received in advance from our faculty. But you should also know that you can submit questions throughout this webinar using the Q&A function, and we're going to do our best to answer them. You should know that this webinar is being recorded, and the link to the webinar will be posted to the NYU Returns webinar series webpage, and we will post that link in the chat for everyone. We're also going to share the questions that you raised today and the questions that you submitted in advance with our communications team, and they'll be able to use those for various communication purposes to make sure everybody gets the answers they need. So things like a quick answer and the other ongoing communications. So with that, I'm going to turn it over to Dr. Ciatoli to start us off.
Hello, everyone, and good afternoon. I wanted to start just with a little bit of background to ensure that we're sort of all dealing with the same facts. As we know, so much changes with COVID, and at this point, frankly, almost on a daily, if not hourly basis. So just to put, I think, some of the recent headlines in context, and then move on a little bit to talking a little bit about the decision-making process, and then lay out the fall semester plan for reopening. Obviously, a lot has been made about the emergence of the Delta virus, which is almost now universally what's being found in positive cases here. It's clear that it has a high rate of transmissibility, much higher than previous variants of COVID-19. What's a little bit less clear is it associated with more severe disease or not? I think there's still some debate about that. But on the plus side, and we'll delve into this a little bit more, the current vaccines still seem to be holding up as fairly efficacious, particularly against severe disease, hospitalization, and death. And while a lot of the headlines focus on the recent surge in cases, and the sort of fourth wave or fifth wave or whatever wave we're into, it really is still a disease of the unvaccinated. And that's not to minimize the impact and the presence of breakthrough cases, but it is still, from a public health concern point of view, a disease of unvaccinated. We do have to acknowledge that breakthrough infections happen, and certainly our overall approach incorporates the fact that we know that breakthrough infections are happening. I do want to point out that over the last month, there have been various case reports of breakthrough infections, of outbreaks among people who are vaccinated. But I want to highlight that the first of those reports, which I believe came out in late July or early August, was reporting on the Provincetown outbreak, which there were numerous people who were positive, The majority were actually vaccinated. But again, to quote from a Johns Hopkins University School of Public Health blog posting about that Provincetown outbreak, when extrapolating, it is critical to understand that the study is derived primarily from one major site in which the activities and settings that were leading to infections are not necessarily representative of the day-to-day life of a fully vaccinated individual. And just to provide a little bit of insight into that, this was a large festival beginning 4th of July weekend. Obviously, a lot of intimate activity was occurring, clubs, bars, restaurants, a lot of social interaction, unmasked, which again is not, hopefully not, what's happening in our classrooms. So again, we have to just make sure that we contextualize that Provincetown outbreak, which was really where this notion of breakthrough cases, I think, first came up. A lot of information, a lot more data now coming out about the waning of immunity of the vaccines, and it's worth talking about that. I think no one would doubt, both from a biologic point of view in terms of looking at neutralizing antibodies and those decreasing over time, the increase in breakthrough infections, that there is evidence of waning immunity over time. But I do want to quote one study because I think it raises an interesting point. When the CDC first came out and the White House said, well, we might need boosters at 8 months, it was based on several studies that the CDC released about 2 weeks ago. And one of those was actually a large study that was done in New York State. So relevant in that it was actually our state, relevant because it was a massive population level study. So it was not just among a cohort of a certain type of individual, in which they looked at all the vaccination records of everyone within the state, millions of records, and millions of test results of those individuals. And what they found was the effectiveness of the vaccine from, I believe, January through July went down by an average of about 12%. From about, my recollection is 91% to 79% for infection, which I will say is still quite good overall for a vaccine to have nearly 80% effectiveness. But what was most interesting was they then subgrouped the population and looked at the effectiveness by age. And if it was purely that the vaccine was getting less effective, if that was the only reason for the vaccine effectiveness to be going down, one would expect the older cohort, those over 65, to have the largest drop in vaccine effectiveness. In fact, it was the over 65 group that had almost no drop in effectiveness. They went from 92% to 89%, a very modest 3% drop in vaccine effectiveness. The youngest group, the 18 to 49 age group, had the biggest drop, going from 90.6% to 74.6%. So about a 16% drop. So again, biologically, physiologically not explainable, but from a behavioral point of view, that was the group that largely got vaccinated so they could engage in other social activities, go maskless. So I think the lesson for me is, and I think we always knew this, but I think had some perhaps false optimism with the early returns on the clinical trials that maybe it would be vaccines and we're good. But I think what we're learning is it's vaccines plus, which I will say we always had intent to include a broad, multi-layered approach to our safety strategy. So to me, it's exceptionally encouraging to see that very modest drop among the 65 plus group that was most likely continuing to adhere to various public health protocols. A lot of debate about vaccinated versus unvaccinated when a vaccinated does have a breakthrough. Are they as infectious? Are they not? The data is a little bit mixed on that. I think where there's some good consistency across all studies is that if you're vaccinated, whether or not your viral load peaks at the same level, it goes down much more quickly. So these people seem to be infectious for a significantly shorter period of time. I also want to point out that just contextually, society is broadly reopening. All sectors of society are reopening, and with rules in place. including education, K through 12. I just saw the city just this morning, talk about things evolving, released their guidance. And I have to say, it is exceptionally modest compared to what we're doing. So again, I think if we look at what we're doing, um, given our highly vaccinated population, which I'll talk about in a minute, the multi-layered strategy to me shows we are taking all of these issues seriously, breakthrough infections, waning immunity, and creating this multi-layered approach to our reopening that frankly exceeds most of the rest of society. In terms of our own decision making, I think sometimes people think that, I sit in my office, I read the guidance and sort of report back to leadership, here's what we should be doing. But people should understand this is a highly interactive process where my own team is consulting with the City Department of Health, the State Department of Health, colleagues at the CDC, looking at all that guidance, colleagues at other schools, formal recommendations by all those bodies, academics in public health, including our own School of Public Health, reviewing the broad public health literature, clinical literature as things emerge, which again, they are doing almost daily at this point. And it's important to remember that guidance is broad. Guidance has to be applicable to all settings. And we have to remember the country is barely above 50% fully vaccinated. We at NYU are inching towards mid to upper 90s of our population being fully vaccinated. So we are in a very good place relative to that. And all the guidance says you need to mold your guidance based on local factors, including transmission rates, vaccination rates, and frankly, our own experience, what worked and what didn't work last year, fully acknowledging that we're in a different situation because of Delta variant, but there are many lessons learned last year. We'll obviously monitor a whole host of things, our own case counts, our own test positivity, what the city is doing. And I might point out, just to be a little reassuring, because I know that people like to throw out the word, we're in crisis and things are getting worse. If you look at the city's dashboard, test positivity is actually declining. Case counts, hospitalizations, deaths have all been stable recently. So all encouraging, I think, as well. The other place that we draw from are our colleagues in Abu Dhabi and Shanghai, who often have had a different set of rules than we've had. They managed all of last year with 3 feet of distancing, 1 meter of distancing, where we had sort of 6 feet, 2 meters, and they ran into no issues. Again, acknowledging that there might be differences because of the Delta variant, but again, collectively pulling in all that knowledge. I just also want to share periodically, people will say, well, you don't understand, I've got this situation or that situation that's very unique. I've shared with people, I have an 11-year-old, unvaccinated, probably won't be vaccinated for the start of the beginning of the school year. So I'm very attuned to the notion also of going back home and what's the exposure of those in the household. So certainly I don't want people to think I'm not empathetic to that issue as well, which is legitimate. But again, I think if we think about our approach, it addresses that issue as well. And as we walk through, I have to say, I think you are safer on the NYU campus than almost anywhere else, perhaps except New Zealand, which has managed to squeeze out every last case. With that said, I do want to walk through sort of our approach, our various layers of safety, which I think starts with, but certainly doesn't end with, vaccination. As I said, we have, I think at this point, exceptionally high rates of vaccination coverage. Among our employees, faculty, both tenure track, non-tenure track, full-time, are, I think, both in the 96 to 97% range. Our administrative staff is 97%. Our various unions are in the low 90s, and we continue to work with all these groups to bump those numbers to as close to 100% as we can get. Our student population is a little bit disparate in that our US-based students are in the mid-90s. Our international students are approaching about 80%, largely because of access issues to the vaccine. I will remind people that we have tied compliance to the daily screener. So you can't get a green screen unless you are compliant. I will point out that compliance does mean either fully compliant with the vaccination schedule, having an exemption and testing, or being partially compliant, because we know some of our international students won't be able to get vaccinated till they get here. We've asked that they immediately get vaccinated and test. So if you have started your vaccination series and tested, you will also get a green screen. We are very closely following the booster issue. I got called by the Department of Health on a completely separate issue related to vaccination, but asked the question, where is the city with boosters? And I think they're in the same boat we are, which is really waiting for official guidance from the CDC. I think it has been made available to people who are immunocompromised at this point. But I think for the broader population, certainly if and when the official guidance comes out, vaccine is made available to those who need boosters, we will certainly facilitate that, whether that again means getting to Langone, having us do it ourselves. I think the other good news, although most of our community was vaccinated with either Pfizer or Moderna, there was a small population that was vaccinated with J&J. They just submitted data around boosters, which was encouraging as well. So we will track that and again, facilitate our community getting boosters when they are indicated and available. So again, I think we start with an exceptionally good base of protection with those high vaccination rates. Now, as I said, we knew we couldn't solely rely on that even before breakthrough, because we knew under the best of circumstances, Pfizer, I think, had a 95% effectiveness. So that meant 5% of people would still end up with infection. So again, we never thought we could solely rely on vaccinations. So we actually never ended up lifting our universal indoor masking mandate, which we will continue. So everyone, whether they're vaccinated or not, will continue to be masked indoors, classrooms, other settings. So that's one. We will have PPE available across campus should people need it. And third, we were thinking of scaling back, but we've now decided to ramp back up our public health ambassador program. So there will be students out and about on campus, encouraging mask wearing, having masks available, and I think sort of norm setting a bit for the community that we are still expecting everyone to wear masks. I know at times people get concerned, what if a student doesn't wear a mask in a class? I will say that that was an exceptionally rare occurrence, at least as far as I heard. Where there are any issues around that, faculty can certainly report it to the compliance line, to their student affairs deans within their schools, to student conduct, but it was exceptionally rare. I probably heard more that, there was the occasional person who kind of had it not covering their nose or, wasn't fully fitted. But again, I think those were the rare exceptions. Most people, certainly when I was in the office, were exceptionally compliant with mask wearing. I do want to talk a little bit about our next layer, which is testing, which does look a little bit different this year, but actually in many ways is enhanced in some places and not as universal as before, but I think actually is a more robust program than we had last year. So anyone who is not fully vaccinated will be required to test weekly. And that is our required weekly testing. And that needs to be done through our BioReference or Bink's test kit program. So that will allow us to know right away if someone tests positive within those groups. And that is something we will track. And as I said, is tied to access to the daily screener and building access. A second category of testing will be what we call indicated testing. Someone who has symptoms of COVID, vaccinated or not, someone who was a close contact of someone who had COVID, that the CPRT deems warrants testing. A third group we're calling discretionary testing, which really allows any member of the community to access testing up to once a week if they, for whatever reason, felt that while they might not have met the definition of close contact, were in a situation that they felt was higher risk. They had prolonged travel, flew from California to New York. They were at an event that was particularly crowded. They were somewhere indoors where there were a significant number of people who were unmasked and again, felt perhaps that that was a significant exposure. So any member of the community under that discretionary testing program can access testing at any point, again, up to once a week. I think when people think, well, where is this more enhanced? Remember, we're actually testing our unvaccinated population, our highest risk group, more frequently than we did last year. If you remember, we tested the bulk of the population every other week. So this is actually more frequent testing for those at higher risk. And we're really trying to risk stratify our testing. I also want to answer the question, because it's come up, why just not test everybody? You know, on some schedule, just test the entire population. And it's an important question to answer. And it's both based on hard numbers, but also our experience last year. And it's important when you do testing to look at the various performance measures of a test to ensure that you're getting results that have meaning to protect your community. And one of the things that we saw last year, and just looking at the test performance, is the specificity of PCR for COVID-19, according to the College of American Pathologists, which is the group, professional association of pathologists, those people who oversee labs. They estimate the specificity of PCR for COVID at 98 to 99%. That means out of 100 people who do not have COVID, 1 or 2 will test positive falsely. So if we extrapolate that out, and let's assume actually the specificity is even a little bit better, let's say it's 99.5%, that would still be 5 out of 1,000 people who might have a false positive result. If you extrapolate that to our 70,000 plus student and employee population, that's 350 false positive test results per week. That is a huge number, something that we never got close to last year in terms of our weekly positivity. And that actually has a lot of implications. It means that 350 people are going to have their routines, their academics, their employment disrupted while they isolate. It means all of their close contacts will either have to quarantine or test and have the anxiety of being told they were a potential close contact. It means our team now has to reach out to hundreds, if not thousands of people, slowing down access to those who are true positives and true close contacts, frankly, making, I think, the community less safe. And frankly, it sort of reports back on a situation that doesn't really exist in terms of the number of cases we have on campus. And to those of you who read the news just this past week, where Rice University went remote because of a quote unquote big outbreak at the start of the semester, that was unfortunately based off of false positive test results. So again, we have to be thoughtful about that. I think we also have to think, well, maybe it's worth having the false positives. We still know that breakthrough infections are uncommon, and that the majority of people who break through are going to be symptomatic and disclose themselves, self-report to us, or have been a close contact, perhaps. And again, if we look back at some of these studies, including a study I just saw this morning, well, it's a little unclear whether they have the same peak viral load. Do they get up to the same amount? One, the viral load does drop more quickly in those who are vaccinated, so they're infectious clearly for a shorter period of time. But two, even some of those early studies that showed that peak viral load was similar in unvaccinated and vaccinated, there's some question about whether that's really viable virus, meaning is it live virus that it can infect, or is it dead virus that's just showing up on PCR, which PCR will pick up. And there was one study literally that I just saw this morning that suggested actually they're less infectious, even if the quote unquote load by PCR is similar, that they actually turn out to be less infectious based off of viral culture. Again, not sort of hanging our hat on that, but using that as one piece of information more broadly as we make decisions about testing. Even in our own sort of observation, because as I said, our population is highly vaccinated. So any positive cases we're seeing now are generally among people who are vaccinated. What we're not seeing is any evidence of sort of onward transmission. Their close contacts are not testing positive, largely because they're vaccinated as well. So I think we just have to take all of that into consideration as we map out what we think is a very risk-based testing strategy and really does not leave any significant risk, again, knowing that we've got these other layers of safety in place. I want to go back and talk about some of the other layers of safety we have, which is density on campus. We're doing a host of things to reduce density on campus. We've continued a fairly restrictive visitor vendor affiliate policy, really allowing only those who are core to the academic or research mission of the university or to core operations. They will have to be approved to be on campus and then comply with our vaccination and testing requirements as well. As many of you know, we've also put out guidelines for meetings, events, and gatherings, which again try to minimize situations where we might have larger outbreaks. We've made exceptions to that. We've worked with various schools, units on that, but again, it's another strategy to reduce density as well. Where possible, we've also continued some distancing as well. So there's guidance for the unvaccinated that if they are at one of these gatherings or larger events, that they do maintain 6 feet of distancing. For eating, we've put out workplace guidance to supervisors so that if we create designated places within the workspace to eat, that everyone maintains 6 feet of distancing, whether you're vaccinated or not. I know there's been a lot of sort of discussion around this issue of teaching zone. And again, all we were doing there is speaking to the people who do space planning. In most of the larger lecture halls, there is the opportunity to have at least somewhere between 7 and 10 feet from the wall to the first row, which generally creates 6 to 8 feet of space between the instructor and the rest of the class. We know that not all classes are lecture style. There are some seminar style classes. But again, where it can be done, we do want to do it. In other places where 3 feet of distancing is possible, we certainly encourage that. But again, where possible, we're adding another mitigation strategy. In terms of case management, we continue to have our COVID prevention and response team who are doing isolation and quarantining where necessary. We find out either because someone has tested positive through our testing program, we get the results of all those back ourselves, so we're aware of those. And we put out a mechanism where anyone who tests positive can self-report. They can self-report a whole host of things, that they've tested positive, have symptoms, they've been in close contact, they've had perhaps travel that they're not sure about what to do. And we get people to self-report. In fact, the majority of our cases now, small number as they may be, are coming through our self-report mechanism. So that group continues to operate. I will say again, this is above and beyond anything the city test and trace corps is doing. So again, another layer of safety. It's clear that we do an excellent job of getting those students who are positive isolated very quickly, which is really the most critical aspect of this, doing the intake, doing the assessment, doing the contact tracing, then figuring out who else is at risk. I will share the current CDC guidance for close contacts is that those who are vaccinated do not need to quarantine, but it's recommended they test at 3 to 5 days. Those who are unvaccinated do need to quarantine for 10 days. If they don't test, it can be reduced to 7 days if they test between days 3 and 5. Of note, just to come back, because this is a faculty group and it's a question that's come up before, we do not do broad classroom notifications because overwhelmingly, most people in the class will need to do nothing. And it just, I think, creates more anxiety. And some people say, well, I just want to know, it allows me to sort of act appropriately, or I can make my own judgments. But again, we're sort of acting within privacy laws that we don't do that broad notification to the entire class. Now, what we also saw last year is students are more than willing to share that information, and that's fine. As a faculty member, you cannot ask a student if they're out because of COVID. However, often they will disclose it again, and that is fine. If a student discloses and you want to make sure that it is shared with us, I would suggest you have them report it. You can just say, here's the mechanism to do it. You should be reporting through the CPRT self-reporting form. I will say overwhelmingly students have been good about that, but I think that is a faculty member's role if they become aware of a case. The other thing I do want to make mention, because this is a group of faculty, is that, and I know we've been working to try to create this flexibility, we're encouraging, whether it's students in the classroom or employees at work, if you are sick, to stay home. I know that causes issues with absences, particularly where class participation is such a critical aspect to the classroom experience, to the grade. And again, we do want students to stay home if they're sick. I think you would want students to stay home if they're sick. If it's something that is potentially COVID related, we're asking them to test. But again, you as a faculty cannot ask them why they're out. And we're also asking that you not ask them for a note. Because again, I think there should be flexible absence policies within the classroom. I know there's been some concern, well, students are going to use COVID now for every excuse under the sun, which may be true. But the truth is, we are no better at discerning whether someone is faking a sore throat or not, or a headache or not, than you would be. So I think having them come in to be evaluated for the sole purpose of a note, frankly, creates more problems within sort of cramped spaces, elevators at the health center and what have you. We are trying to keep mildly ill people out of most public spaces. So again, really hoping for some flexibility on both of those issues. We are encouraging, but certainly not mandating, to the extent possible, sort of assigned seating so that students simply stay cohorted throughout the semester. If there are mechanisms for attendance that are readily available, we'd encourage you to use those. But again, not a hard mandate on that, knowing that it may be problematic in certain types of classes. And then again, I can laundry list the issues that we were addressing around ventilation. I know that sometimes comes up. I have a host of bullet points that I can quickly read. I do want to make sure we leave time for testing, but we work closely with the VP for Facilities and Construction Management on ventilation issues. And what she shared with me is the things that they've done to ensure adequate ventilation, increasing the introduction of outdoor air by opening outdoor air dampers, increasing the minimal setting on HVAC systems so they draw at least 25% of circulated air from outdoors, ensuring that the ventilation systems are all operating properly and provide acceptable indoor air quality for different occupancy levels, disabling demand-controlled ventilation, a change that increases total airflow in line with CDC recommendations, improving central air filtration without reducing design airflow, and making sure that all the filters are sized properly and up to date. So again, all of these things collectively give me confidence that we can open the semester in person safely. I will say, just again, quickly eyeballing the city's guidance for the public school system, we are heavily exceeding what the city school system is doing, and that is among a population that is probably at least half unvaccinated, if not more. So again, relative to the rest of society, and frankly, relative to the rest of higher ed, I think we have an exceptionally robust safety plan heading into the fall. So I will stop, and I think Gigi, turn it over to you.
Thanks so much, Carlo. Good afternoon, everyone. I just want to start by reiterating the thanks that Chris gave this group for the really amazing, heroic work that you did through last year, and to tell you that we're so very grateful for it. And I hope that the summer has provided you with at least a little bit of downtime and some well-earned break from everything. But now we are gearing up for the semester ahead. Just to repeat what Carlo has said in a much more detail, or what Carlo said in a more detailed way, health and safety remain our absolute top priority. at the whole university and also in the classroom. You heard from Carlo the multi-layered approach that the university is taking. And I just want to add one small thing, that if at any point there's any indication that suggests a change of course is necessary, that Carlo will be the first one advising the university to do that, and that we will be nimble and responsive. I want to now just turn a little bit more to some of the questions that have come in about how classroom will work and some of the academic policies going into this year. I want to, before I do that, just tell you how very important the in-person teaching is to our students. In a survey that was conducted at the end of last spring, asking students what would bring them back to NYU this year, the number one reason, hands down, above New York City, above hanging out with friends, the number one reason was the in-person classes. So thank you to all of you again for being the reason our students want to keep coming back. I want to start with the question of non-compliant students and consequences. I will begin by saying that the number of non-compliant students that you can expect in your classes is exactly 0. Non-compliant students will not be at the university. They will be de-enrolled from any in-person classes. They will not have access to any university building, classroom buildings, residential dorms, dining facilities, gyms, etc. So just to hopefully assuage some anxieties about that. And I should also report that the number of non-compliant students, which Carlo told you is already very low, and keeps shrinking every day. And everything we are hearing is that those students are simply late and not planning to remain non-compliant. So we are getting there. In terms of in-person, there's been some questions about what the policy is in terms of flexibility there. Any class that is scheduled as in-person should be taught in person. In terms of student access to classes, any class that is offered as in-person, we are telling students that the kind of flexibility that the university was able to provide last year by allowing both in-person attendance and remote attendance at in-person classes won't necessarily be possible, and in most cases won't be possible this year, except for those schools and those programs that have made specific provisions for that. Attendance, Carlo touched a little bit on attendance, but because we've had some questions, I just want to drill down a little bit. If a faculty member is feeling unwell in any way, they should stay home. You are not expected, not only not expected, but asked not to go to your classroom or your office or anywhere else. If you are feeling unwell, stay home, take care of yourself. If they are COVID-like symptoms, get tested. If you are feeling well enough and you want to meet your class remotely during the time that you are not going because you're symptomatic in some way, you are absolutely welcome to do so. And if not, please simply do what you would do any other year when you weren't feeling well. Reach out to your chair, to your department, let them know that you need to be absent from class, and you could either cancel the class, reschedule it, provide asynchronous material, ask a colleague to substitute for you, etc. If a student is in any way feeling unwell, they should stay home. So Carlos said this, I just want to talk a little bit in terms of some of the attendance policies that may be in place for some classes. We're asking that faculty please be flexible in expecting and allowing more absences than usual, given that we are instructing students that if they have any kind of COVID-like symptoms, they should remain at home. We are not requiring, we ask that you not require doctor's notes for these kinds of absences. We are asking that you please provide students with ways of keeping up with their work. That might mean, for some of you, the easiest thing might be to turn on your Zoom camera and allow students who are home but feeling well to come into the classroom that way. It might be any number of other ways that you provide students with ways of keeping up. You might record your lectures, you might give them your class notes, or have a student note taker assigned to provide them with notes, but just that you provide ways for them to keep up. Let's see, Monique, would you mind putting into the chat the document? Let me see if I can grab it, that we've devised. It's just some strategies for teaching temporarily remote students that would apply for either students who might be out, or for students who might have international students who might have visa related restrictions and come in late to your class. Thanks, Monique. For prolonged absences, if a student is out for a prolonged period of time, or for many, many repeated absences, in those cases, we can certainly ask for doctor's notes, but the kind of one-off because they have a scratchy throat, we're going to ask you to please just let those go this year. Let's see. In terms of, I guess there was, Carlo answered a question about Carlo, I think you touched on the question of assigned seating. So to the extent that that is possible, that would be helpful. And really, if there is anything that any questions that you have at any time, we are happy to take those. And thank you again for all you're doing, and look forward to continuing the conversation. Clay, on to you.
Thank you so much, Gigi. Yeah, and then the last thing to say, which I think is fairly obvious, is there will be a much more in-person experience starting next week. Most faculty and students will be on campus because of the adaptations to COVID, both in the past and ongoing. The first week is likely to involve a lot of resituating ourselves. Many of you will not have been in a physical classroom in the last year and are returning for the first time. So I just want to talk a little bit about easing that transition. There are 3 things you could do this week that would help in terms of a sort of advanced checklist so that you're not dealing with them also on the first day of class. One is to get a sense of what the technology in your classroom is like. One is to set up your Brightspace, your course shell on Brightspace, the new learning management system, if you haven't done that already. And one is just to check your ID card. So the first one, classroom technology. For those of you who were teaching in a classroom in the last fall or this spring, nothing has changed. The setup will be much the same as it was. For those of you who haven't been in a classroom in a while, we added in the last 18 months a number of adaptations to allow students attending remotely to Zoom into the class for the sort of hybrid learning pattern that we had to support. You will find in those rooms things that are called Zoom carts, although they confusingly aren't carts. That's just the language IT uses to refer to them. The big difference between Zoom carts and what you're used to from the podium technology, the technology that was at the podium of classrooms, is that you run a Zoom cart from your own laptop or tablet or other device. So the first thing to do is to just go, and I will paste this into the chat, get your classroom identifier from Albert, find out what classroom you're in. If you are in a general purpose room, which is to say a university run classroom, and I've just pasted the URL into chat, that is a room with a Zoom cart in it. If you are not in a general purpose classroom, if you are in a room that's run by your own school, you can check with your school's ed tech contact. Now just pasted ed tech support into the chat as well. And you can always go to your school ed tech for any of these questions. Effectively, some schools have maintained the podium model. Some schools have moved to the Zoom model. All of the university classrooms, that first list, are on the Zoom model. And so it's really just a question of whether you need a laptop in the classroom to drive the technology or not. The university is buying additional laptops if for some reason you can't bring a laptop or tablet that you have, again, let your school ed tech representative know. The second thing you can do is just to set up your course shell on Brightspace. As you will have seen from communications over the last, really over the last couple of years, we've been moving to Brightspace, a process that started in late 2018. We're in the last phase of that move now. Many of you have set up your course shells, but if you haven't, this may be the first semester you're using Brightspace. Just go to that, the link I just pasted in the chat. It will walk you through setting it up. Brightspace is much easier to use than Sakai, our previous learning management system. Again, if you have any questions, you can go to school ed tech support. You can always write to Ben Maddox and myself also on these issues. I'll just put this in the chat at vpedtech at nyu.edu. The reason to do this now, a little earlier than you might sort of check in on your course site and classes, is simply that next week is going to have a lot of questions coming into the helpline. It's effectively a new phase of COVID adaptations, and we want to try and get all the advanced work we can out of the way in the next couple of days, so that when Monday morning rolls around, we're not simultaneously dealing with course shell questions and also people who are in a classroom trying to adapt. And then the last thing is just, we've run into this week, and I just want to remind everybody, check your NYU ID, because badging in and out of buildings will only work if your ID is current. Obviously, for many people who have been teaching remotely, you can log in with your net ID fine, but your ID card could potentially have expired. So just check the date on the back of your ID card, make sure you can get in and out of buildings. And with that, I'll turn it over to Chris and see if there are other questions.
Okay, thank you, everybody. Before we go into more questions, I want to share answers to some questions we've already received related to children and childcare support and the New York City school system. So we got a question about how can NYU help with childcare support this year? And I want to tell you that there's many things that are available to our full-time faculty. And I'm going to ask Monique to post into the chat the childcare resources links. But some of the resources that are available include 2 different programs that constitute childcare funds for faculty. One of those is a subsidy program that's for faculty who have an annual base salary under $120,000. There's also an assistance program for faculty with an annual base salary that is $120,000 or more. In addition to these childcare funds, we have a childcare Google group, which is something our work life office set up, which is a Google group for NYU families and students only who want to connect around caregiving needs. Also, there is a new app that we purchased called Kome, which is a cooperative childcare app where NYU families can share, can meet each other and determine whether they have similar parenting styles and COVID practices, and find people with whom they can rotate care for their children. And you should know that Work Life is available for consultations. If you want to talk to somebody about what kind of support you need and what's available, you can reach out for an individualized conversation with Work Life. We also got a question. If we have kids who are home from school because they're quarantining from school, but they are COVID negative, is Bright Horizons backup care available? And the answer to that is yes, as is Kome and the Google group that we just discussed. We also got a question about, is there going to be coordination with the New York public school system if they go remote? And the answer to that is that we don't always coordinate our operating status with New York public schools. This isn't the same as closing. This would be whether to operate in person or remote. So it certainly might inform what we do, but it's not going to be absolutely determinative about how we respond. So now I want to take additional questions, and we're going to start with question for you, Carlo, which is, if faculty members stay a certain distance away from their students in the classroom, let's say 7 to 10 feet, do they still need to wear masks?
So we are asking everyone, regardless of distance, to continue to be masked. Where we are allowing a little bit of discretion is, and generally with sort of departmental sort of approval, if by nature of the teaching, it's important, let's say, to be able to see like with languages where, the formation of words and what have you, allowing clear masks to be used. That's sort of being done at the department level. University procurement is only purchasing one sort of standard mask. We are allowing, again, a little bit of flexibility in the type of mask. Again, generally, if it's related to the sort of that type of particular teaching. But again, are requiring that everyone continue to be masked indoors.
Thanks. And Carla, while you're speaking, another question for you. Can you elaborate a little bit about how the university does contact tracing?
Sure. So, I mean, it is generally done. We have all of our, and they're all nurses. They've all done the Johns Hopkins online contact tracing program. So it is a standard approach to contact tracing where the person who's positive gets outreach to, and there's a fairly robust intake that's done that essentially tries to trigger every single interaction they may have had over the past several days, dating back to their even asymptomatic infectious period. And then those close contacts are identified, and then they're reached out to and advised on whether they need to test, quarantine, or both.
Thank you. A question for you, Gigi. Does the university have a policy related to field trips or taking students places? Or maybe Carla, you might prefer to speak to this, one or the other of you.
I mean, we're generally allowing those as long as it's following the other sort of protocols and rules.
Okay, thank you. Let's see here. We have a question about the dashboard. Are there changes in how the dashboard's going to be reporting data on positivity rate this year?
Yeah, so just because I think there's another question, I'll try to sort of answer two questions at once, which is, are there any metrics that we're tracking that would trigger perhaps, a shift to remote learning? And I think both our approach last year and I think what we learned, and I think it validated our approach, while we did put up the testing dashboard, in part because you remember the state actually had criteria around which we had to go remote. Our testing approach is different this year. So we were hesitant to roll it over because it would be sort of an apples to oranges comparison. So for the moment, we have not posted the dashboard. And right now, the approach to testing is so different in different places that it's very hard to make comparisons. I think we'll revisit the information that we'll put out publicly. On the issue of which metrics are we tracking, and we're tracking a whole host of metrics where we're, I think, again, validating our approach last year. We're not really saying like, well, if test positivity is above this, or we have this many cases, we're going remote. I think you saw last year when the city and state tried to do that, they did it for a few weeks, and the minute it became irrelevant, they threw it out. So a lot of that color coding by neighborhood, ended up being not relevant as conditions changed. So, we'll continue to work closely with the city DOH. We frankly are in touch. I was probably in touch with them every week or every other week just to go over where we were, whether things were good, bad, or otherwise, just to sort of get an assessment of their thoughts. So again, we'll track the metrics, but I don't think we're going to tie ourselves rigidly to if this goes above this or below that, we will do X, because it proved to be, honestly, even for the city, really not relevant.
Thank you. Clay, this is a question for you, I think. What about faculty who may need microphones? So those who are teaching in large spaces and may need amplification?
So again, those microphones will be distributed by your tech support, the instructional technologist in your school, which is the earlier list I submitted. We have in general found that classrooms with fewer than 50 that hold fewer than 50 students, faculty have ended up not needing to use those microphones. I think there's a lot of concern about voice dampening from masking. It is not proven to be a big deal, but certainly for classrooms 50 and above, we have microphones available. You should contact your school representative and ask, tell them when you're teaching and in what room, and ask about amplification.
Thank you. Carlo, here's a detailed question about how the green screen is going to work. Regarding the green screen for NYU building access, will exempt and partially vaccinated people only get a green screen if they have a negative test within 7 days?
Sorry, I was muted. That is exactly correct. So if they are either exempted or partially vaccinated, they must have a negative test result within 7 days to get building access, to get the green screen.
Excellent. And Carlo, another question for you. How are students being informed of these policies and what's expected of them?
I believe a lengthy email literally just went out to students that goes over this. Obviously they, I think, were on many of the other various community-wide emails that have gone out over the last several weeks, but there is a specific student email that has gone out. I believe it was due to go out at 12:30, I think. So, which goes over literally almost every single thing that we talked about, from vaccination to masking, sort of expectations of their behavior, across the board. So I think that was laid out, and I imagine will be reiterated, at the start and throughout the semester.
Thank you. We got a request to repaste in the chat the link to this recording. Can somebody do that if you haven't done it already? And then maybe this is a question, let's see. A question for you, Gigi. I think we've already touched on this, but maybe you can repeat this or elaborate. Are we going to need assigned seating in classrooms this fall?
So the assigned seating tool will still be available on the LMS, and we would ask you to please use those in your classes. If some of your classes require students to move around or to work in small groups, please do that, but do it judiciously, maybe not constantly moving, and that they do that only one time, let's say per class session, just to facilitate any necessary contact tracing down the road.
Thanks. A question for you, I'm sorry, go ahead, Carl.
I was going to take one question that I see only because it gets to a larger issue just about, I think, the partnership between faculty and us. There's a question about, is there a notification protocol triggered by multiple infections in a single classroom that might allow faculty and students to be notified? And I think the short answer there is yes. And curiously, there were several situations last year where we saw a cluster either within a classroom or a department or a program. And we did exactly that. We reached out to the dean, the department chair, the faculty. And of course, what the fascinating thing was, and just to give a couple of examples, which I think I've shared with others, Stern Executive MBA. So we had a week or two, we seemed to have a disproportionate number of positive cases. When we went to actually look, they weren't in the same class, but it turns out they were all going out as part of their networking after work, unmasked, doing what Stern Executive MBAs do after work in terms of networking. Same with some of the Tisch performance cohorts. It turned out they were completely online. So there was no class to be, but what was shared with us is their cohorts are their whole life, and they do everything together within their cohorts. So they were dining together, rehearsing together outside the classroom. I think the important thing is, if we ever have concern more broadly, we will absolutely reach out. And I would say the reverse is true. If you find out and you've not been notified, but you've got a series of unexplained absences, you're finding out that there were multiple students in the class that are out, there's no reason you can't reach out to me, to CPRT, sort of for further exploration. I mean, I think we've always tried to establish partnership in this, because I think no one person or one group has all the information. And I think that proved useful for us, usually actually to be more reassuring, because as we found out more, it turned out the classroom wasn't the source of spread. But again, I think people should feel that this is a partnership, not us saying like, okay, here's what we're doing, and it's inflexible, and there should be no discussion about it.
Thank you, Carlo. We're just about out of time, but I'm going to turn it to Gigi for 2 final answers related to teaching assistants and outside visitors.
Sure, thanks, Chris. So there was a question about whether faculty could allow their TAs to change in-person recitations into online recitations. And the expectation for TAs is the same as it is for faculty. If the class is listed as an in-person class, they're expected to teach it as an in-person class. If they have any need for accommodations, they can, for a medical accommodation or something related to a disability, they can, of course, request those just as faculty can. But in-person classes really should be meeting in person, and that includes recitations. And then there was a question that came in about how can we invite speakers from nearby universities to come to our classrooms. And I'm just going to try to paste here. So only vaccinated affiliates and visitors whose in-person presence is really deemed essential to the academic mission should be on campus. But if you would like to request to bring a speaker that you think is really important to your class, I've just pasted the link into the chat, and that's also available on the NYU Returns page. Thank
Very
you.
good. Thank you. We are just a little beyond time, so we're going to close it here. I want to thank everybody who's joined us today for your really thoughtful and helpful questions and for being part of this session. And on behalf of everyone on this panel and the entire university, I want to wish you a very good start to the new academic year. Thank you again for everything that you do on behalf of the NYU community.